Ladies and gentlemen, we will come back again to our webinar. We had 1 hour break. How are you? Are you re-energized? I hope you re-energized, right? Alright, ladies and gentlemen, we will now discuss about 2 critical topics. We will discuss about global burden disease of human immunodeficiency virus, and we will discuss about management of human immunodeficiency virus in pregnancy. We will discuss about this with our outstanding speakers, with Professor Dr. Syed Amir Gilani and with Dr.Preeya. But with leading the discussion, we have our moderators today, Mrs. Nuni Apriani. Mrs. Nuni Apriani will leading the discussion on this second panel, on this 4th topic and 5th topic. Alright, ladies and gentlemen, let me read our moderator's CV. Mrs. Nuni Apriani was born on 26 April 1988. She's completed her Master of Degree in Pajajaran University and Medical Surgical Nursing Specialist on Muhammadiyah Jakarta University. She has a lot of experience. She has published a lot of books. One of them is about medical surgical nursing, especially in respiratory system. She's awesome, right? And she has a lot of research. One of them is uncovering the benefits of povidone iodine compared to other therapeutic agents in wound infection prevention and healing outcomes, a scoping review. She's really awesome. So, ladies and gentlemen, let's welcome Mrs. Nuni Apriani. Please give a round of applause.
Okay, thank you for your warm welcome, Mariana. Good afternoon, everyone. My name is Nuni, as a moderator for this session. It is an honor and pleasure to welcome you on today's seminar of HIV topic. Excited to see such a diverse and engaged group of professionals, scholars, and enthusiasts gathered here. Today, we are privileged to hear from distinguished lineup of speakers who bring a wealth of experience and expertise to the table. Each of them has generously agreed to share their insight and perspective on HIV topic. Our agenda has been carefully crafted to provide a comprehensive overview of HIV topic, featuring a mix of presentation, interactive session, and networking opportunities. As we embark on today's journey, I encourage you to take full advantage of the resources available and immerse yourself in the discussion. Once again, thank you for joining us. Let us make this seminar a memorable and productive experience. Without further ado, I am pleased to introduce our first speaker, Professor Dr. Syed Amir Gilani from Green International University, Lahore, Pakistan, who will be presenting on global burden disease of HIV. Let me introduce our distinguished speaker, Professor Syed Amir Gilani. He is rector of Green International University, Lahore, Pakistan. He has so many experience in education and international linkage. He also get many honor and award, and also has so many experience. Okay, Professor Dr. Syed Amir Gilani, are you joining us? Yes, I can hear you. Assalamualaikum warahmatullahi wabarakatuh. Okay. Pro okay, Professor Dr. Syed Amir Gilani, you can start your presentation. Time is yours. Yes, we can see. Professor, Professor, I'm so sorry. Can you slideshow your presentation? Not yet. Maybe we can help. Oh, okay. Yes. Maybe. Okay. Okay, it's clear.
Is HIV transmission varies geographically, influenced by factors.
Professor?
Yeah, can you hear me?
Yes, we can hear you clearly.
I think there is some problem with the internet. So global distribution HIV is prevalent in many regions, with sub-Saharan African experiencing the highest burden. And as I was discussing, the transmission is usually from the sexual behavior, injections, drug use, and access to healthcare. The
Professor,
population groups which are,
Professor, I'm so sorry. The presentation is disappear. Maybe we can help sharing your presentation.
yeah, if you, I have sent you, you can share it from your side.
Okay.
So do we start?
Yes, you can start, Professor.
Okay, so I have introduced AIDS. It is the human immunodeficiency virus, which is retrovirus that infects and weakens the immune system, making individuals susceptible to opportunistic infections and diseases. So once the immune system is weak, the opportunistic bacteria and fungal diseases will attack. The acquired immunodeficiency syndrome is the most advanced stage of HIV infection, and there will be severe immune deficiency and a high risk of life-threatening illness. If we talk about the global crisis, has had a profound impact on global health, leading to millions of deaths and affecting millions more. Next, please. Next slide. The mode of HIV transmissions are sexual contact, blood to blood by sharing needles, blood transfusion, or other blood related exposures can lead to HIV transmission. And mother to child, like HIV, can be transmitted from an infected mother to her child during pregnancy, labor, delivery, or breastfeeding. So, understanding the mode of HIV transmission is crucial for prevention efforts. Next, please. The risk factors for HIV infections include unprotected sexual contact, lack of condom use increases vulnerability, and injection drug use, sharing needles spread the virus, mother to child transmission, and breastfeeding. And the fourth one is blood transfusion, which is unsafe blood transfusions can transmit HIV. We must assess the blood for HIV virus before giving to anybody. So certain behaviors and circumstances increase the risk of HIV infection. Next, please. The pathogenesis of HIV infection includes viral entry. It enters through the blood, through mucosal surfaces of the bloodstream. Immune system targeting. HIV primarily targets CD4 plus T cells, a critical component of the immune system. Viral replication. HIV integrates its genetic material into the host cell's DNA, leading to viral replication. Immune system decline. Over time, HIV destroys CD4 plus T cells, weakening the immune system. So the last step is opportunistic infections, in which different bacteria, fungal infections can attack the weak or compromised immune system. So this is the pathogenesis. Next, please. The clinical stages are: stage 1 is acute HIV infection, initial infection, flu-like symptoms. Then is the clinical latency. HIV is present, but dominant immune system is weakened. Stage 3, in which severe immune deficiency, opportunistic infections will be there, and HIV infection progresses through distinct stages, each characterized by specific clinical features and immune system status. Next, please. I have written some articles on AIDS and co-authored some of the publications. I have mentioned here about three, uh, which includes the global, regional, and national sex-specific burden and control of HIV epidemics 1990 to 2019 for 2004 countries and territories. The Global Burden of Diseases Study 2019. It was published in Lancet HIV 2021. I was one of the co-authors. The second, my co-authored publication was Mapping Sub-National HIV mortality in 6 Latin American countries with incomplete vital registration systems, local burden of disease HIV, which was published in British Medical Journal in 2021. Then is the global age, sex specific fertility, mortality, health, life expectancy, which is abbreviated as HALE, and population estimates in 2004, countries and territories 1950 to 2019, a comprehensive demographic analysis of the global burden of disease study 2019, which was again published in Lancet in 2022. Next, please. The global burden, I will have 2-3 slides about discussing the global burden, which is my main topic. HIV is a global health crisis impacting millions of people worldwide. The World Health Organization estimates that 39 million, which is 33.1 million to 45.7 million people globally were living with HIV in 2022. Next. Sorry. The fact sheet, which was published in 2023, says that 1.3 million people became newly infected with HIV in 2022. 630,000 people died from AIDS-related illness in 2022. 29.8 million people were assessing antiretroviral therapy in 2022. 85.6 million people have become infected with HIV since the start of the epidemic. 40.4 million people have died from AIDS-related diseases since the start of the epidemic. Next, please. In 2022, there were 39 million people living with HIV. 37.5 million adults, 1.5 million children, and 53% of all people living with HIV were women and girls. So more burden on females. 86% of all people living with HIV knew their HIV status in 2022. So this was awareness in which 86% of the people were aware that they have AIDS. About 5.5 million people did not know that they were living with HIV in 2022. Next, please. People living with HIV assessing antiretroviral therapy. So those who were living with HIV, among them, what is the stat? At the end of December 2022, 29.8 million people were assessing antiretroviral therapy, up from 7.7 million in 2010. So in 2010, just 7.7 million people were getting the antiretroviral treatment, whereas in 2022, about 4 times the people, which were 29.8 million people, were getting it. In 2022, 76% of all people living with HIV were assessing treatment. 77% of adults aged 15 years and older living with HIV had access to treatment, as did 57% of children aged 0 to 14 years. 82% of women aged 15 years and older had access to treatment. However, just 72% of men aged 15
Professor? Professor, are you here with us?
Yeah. Yes, yes.
Okay. Okay, you can continue, Professor.
Yeah, so I was discussing that 82% of pregnant women living with HIV had access to antiretroviral medicines to prevent transmission of HIV to their child in 2022. Next, please. New HIV infections have been reduced by 59% since the peak of 1995. In 2022, 1.3 million people were newly infected with HIV compared to 3.2 million people in 1995. Women and girls accounted for 46% of all new infections in 2022. Since 2010, new HIV infections have declined by 38%, which is a positive factor, from 2.1 to 1.7 million in 2022. So since 2010, new HIV infections among children have declined by 58% from 310,000 to 130,000 in 2022. Next, please. AIDS-related deaths. This data says that AIDS-related deaths have been reduced by 69% since the peak in 2004 and by 51% since 2010. In 2022, around 630,000 people died from AIDS-related illness worldwide compared to 2 million people in 2004 and 1.3 million people in 2010. AIDS-related mortality have declined by 55% among women and girls and by 47% among men and boys since 2010. Next, please. Next. The key population globally, median HIV prevalence among the adult population. If we compare the women and girls, globally 46% of all new HIV infections were among women and children. In sub-Saharan African, women and girls accounted of 63% of all new HIV infections. In all other geographical in 2022 occurred among men and boys. Every week, 4,000 So sorry for this frequent process. I don't know whether it is from other side or from my side, but there is some problem with the internet. My signals are full. So we were discussing about women and girls load. And every week, 4,000 adolescent girls and young women aged 15 to 24 years became infected with HIV globally in 2022. And 3,100 of these infections occurred in sub-Saharan Africa. Next slide. Investments at the end of 2022, about 20.8 billion US dollars are available for the AIDS response in low and middle income countries. Around 60% was from domestic sources. Then an AIDS or UNAIDS estimates that 29 billion US dollars will be required for the AIDS response in low and middle income countries, including countries formerly considered to be upper income countries in 2025 to get on track to end AIDS as a public health threat. Next, please. Next slide. WHO response, the global health sector strategies on respectively HIV, viral hepatitis, and sexually transmitted infections had a good response from the UNICEF, and there were many uh, prophylactic and preventive measures were taken. The diagnosis and testing for HIV, we can have laboratory test for HIV testing involving detection of the antibodies or viral RNA in blood sample. The types of tests include common tests, which are ELISA or Western blot, and rapid antibody tests, which provide quick results. Confirmatory testing like positive results from initial tests are confirmed viral load test, and people. Next slide, please. These are few examples. You can see the CT, MR, then we have the contrast imaging, the PET-CT ultrasound on which you can see the hyperactive kidney which is infected, the lymph node enlarged, and changes in the lungs. The radiology can help a lot in the diagnosis along with the lab tests, serum tests. Next, please. The therapy includes the HIV suppression, like the antiretroviral therapy, which is abbreviated as ART, reduces viral load and shows disease progression. Immune system restoration, ART helps restore and strengthen the immune system. Improved quality of life, it improves overall health and well-being. And prevention of transmission, ART significantly reduces the risk of HIV transmission. Next, please. So we have to adhere with the ART for regular medication intake, have a supportive care, patient education is important, and monitoring and evaluation is very important. So if we monitor, we educate the people, we give support, then it can help us to cure the disease. Next, please. While viral suppression and HIV treatment outcomes, the viral load reduction effectively reduces viral load to undetectable levels, improved immune functions. The ART strengthens the immune system, reducing opportunistic infections. It increases life expectancy.
Professor, Professor, are you still there? Professor, Professor? Okay, I think due to the connection problem, we have to wait Professor for joining us again.
Yeah, I'm here. Sorry, it was again. My
It's
systems
okay.
are okay, but I think there is some problem. So next slide, please. So for prevention of HIV transmission, it is recommended that condom is used while having sexual activity to prevent HIV transmission. Needle exchange programs, in which the needle exchange program reduces the risk of HIV transmission among people who inject drugs. Then ART effectively reduces viral load, minimizing the risk of transmission. And pre-exposure prophylaxis and post-exposure prophylaxis are also important. Like for pre-exposure, is a daily medication taken by HIV negative individuals to prevent infection, whereas post-exposure is short-term course of medication taken after potential exposure of HIV. Next, please. Harm reduction strategies, needle exchange program, provide clean needles to reduce the risk of HIV transmission among people who inject drugs, and provide substitution therapy, in which the methadone and buprenorphine reduces craving and prevent relapse, reducing risk behaviors. And safe injection sites, supervised consumption facilities provide a safe space for drug use, reducing overuse risk. Next. So I have already discussed the pre and post. You can skip the 2 slides. Next, please. Next. So the vertical transmission of HIV, mother to child transmission, can be transmitted from an infected mother to her child during pregnancy, labor, delivery, or breastfeeding. And ART for pregnant women, safe delivery practices, and avoiding breastfeeding reduces the MTCT, which is the mother to child transmission. Pediatric HIV, infants born with HIV require early ART to prevent disease progression to ensure healthy development. So vertical transmission of HIV refers to the transmission of the virus from an infected mother to her child during pregnancy, labor, delivery, or breastfeeding. This is a significant concern, but with effective prevention strategies, the risk of mother to child transmission can be drastically reduced. Next, please. So we can have HIV in children. That the prevention strategy is the same as I have discussed earlier. The early diagnosis is important so that we can treat them, and specialized care for pediatric group is more important. And for pediatric group, it is recommended to have a long-term management so that they adhere to the treatment and they are properly cured. Next, please. Comorbidities and co-infections, we can have increased vulnerability, weakening the immune system. There will be infections and diseases. There will be co-occurring conditions like diabetes, heart disease, or mental health issues can occur, or they can complicate the disease. Complex management, when there are co-infections, they require comprehensive approach, including medication, lifestyle changes, and support services. Next, please. HIV and tuberculosis, there is increased susceptibility because it will weaken the immune system, making individuals more vulnerable to tuberculosis. There will be co-infection rates, which will be increasing in the patients of tuberculosis. The disease progression, TB infection can progress more rapidly in people living with HIV. There will be treatment challenges because the patients with the tuberculosis and HIV, they need treatment for disease. Next, please. Next. Next slide, please. So stigma and discrimination, there are social exclusions, prejudice and bias can lead to social isolation. Fear and misinformation, lack of understanding about HIV, fuel stigma. People will be afraid having stigma, and there will be discrimination, which is unfair, and it will not help to treat the HIV patients. The barriers to care, stigma can deter people for seeking services. They will be hiding their disease, and there will be discrimination leading to psychological problems. Next, please. Services can be availability, accessibility, affordability, and acceptability. Availability is nowadays it is available in most of the parts of the world, and there are many populations which have accessibility also. Affordability, cost effective, and subsidized services are available, so it is not expensive. And culturally sensitive and non stigmatizing services are there. If the patient is getting counseling and is having more courage and strength, then socially and culturally we can help them to accept the treatment, and that will be easier to assess the HIV services. Thank you. Next. Health systems, HIV care, like the integrated care, strong infrastructure, human resources, financial sustainability, and data availability and monitoring are 5 steps which are needed for HIV care and recommended by WHO for health system. Next, please. Funding and financing. We can have global funding landscape in which the the PEPFAR is an organization, the global fund, and PEPFAR can provide crucial funding in these programs for low and middle income countries. We can have domestic funding, and very interesting is that most of the countries, the domestic funding is number one. Then the private sector investments play a growing role in HIV funding, supporting research development and innovative approaches to care. Next, please. The global initiatives and partnerships. The Global Fund to Fight AIDS, Tuberculosis, and Malaria is one service which is available. The second is the US President's Emergency Plan for AIDS Relief, which is called PEPFAR by the US government. It is available. Then Joint United Nations Program on HIV, which is called the UNAIDS, lead and coordinates the global HIV response, advocating for policies, mobilizing resources, and promoting access to HIV services. Next, please. So we have challenges. The first is financial constraints, stigma and discrimination, which is very important. We have to avoid the biasness, and because it will affect the patient's psychological strength to fight with the disease. The lack of awareness, sufficient knowledge about HIV transmission and prevention must be provided in the community, and treatment access, unequal distribution of resources, limit access to medication. Next, please. So, future directions and research priorities. The novel therapies develop new drugs and treatment for HIV. This is the need of time. Prevention strategies must be re-evaluated and new ones must be explored. Research for cure, especially investigate potential cures for HIV infection. We must look for long-term management, develop strategies for managing HIV in the long term. Social and behavioral factors address the impact of stigma and discrimination. These are 5 steps which are needed for future. Next.
Professor. Professor.
So the last slide is take home message. The global response to HIV/AIDS has made significant progress, but challenges remain. Continued efforts are needed to achieve universal access to prevent, treat, and care services. Addressing stigma, discrimination, and financial constraints is crucial for ensuring an equitable and effective response. Research and innovation are essential for developing novel therapies, improving prevention strategies, and exploring potential cures for HIV. Next.
I think that's the end of the presentation, Professor.
Yeah, thank you very much.
Okay,
With
thank
this,
you
we
very much.
finished presentation. There
Okay.
were a lot of disturbance by the internet. I'm sorry for that.
It's okay. Thank you very much, Professor Dr. Syed Amir Gilani, for your insightful topic about global burden of HIV. Maybe I will read a short summary of this topic. HIV is a global health crisis that impacting millions of people worldwide. The number of people with HIV increase year by year, including children. In 2022, 630,000 people dying from HIV, and about 5.5 million people didn't know that they were living with HIV. HIV impact many aspect of life, including stigma, discrimination from social environment. Okay, for the sharing session will hold after the second topic. On the second topic, we will discuss about management of HIV in pregnancy. Let me introduce our second speakers, Miss Priya Keawpimon. I'm so sorry if I spell it wrong. Miss Priya is assistant professor doctor at Faculty of Nursing, Prince of Songkhla University. She has so many research, especially about philosophy and holistic nursing program. The last research is about life experience of female Muslim student marrying to legitimize romantic relationship in Patani Province, Thailand. ASEAN, ROK Cooperation Fund Asian Association of Women Studies. Miss Priya, are you here with us? Miss Priya? Miss Priya, can you hear me? Miss Priya, thank you for being here with us today. Okay, Miss Priya, time is yours.
Okay. You unmute my microphone. You mute.
I'm so sorry, Miss Priya.
Okay. Good afternoon, everybody.
Good afternoon.
Hello. Hello from Thailand. Nice to meet all of you here. Can you hear me clearly now?
Yes, I hear you very clear.
Today, I come with this uniform because I teach in the delivery room. My background, I am the nursing and my specialist in midwifery. So today I will share with you about the story of HIV/AIDS in Thailand, and in the same time, because we focus on pregnant women, I will show you how we treat the HIV/AIDS pregnancy in Thailand. The first time I am invited to talk, I feel very surprised because when we talk about HIV/AIDS in Thailand, it's something very far away right now because the situation is already calm. It's not so much serious. Everything are in the system, and the number of the case is not so high. If we compare with the 30 years ago, at that time, I am a PhD student. That very crisis, many people die, and there are many problems, not only the medical problem from the HIV/AIDS. We had a lot of case that with the full brown AIDS. But in the same time, because the situation is very crisis and it is like negative image of the people who are infected. They are biased, they are discriminated. It's very strong in that time. But right now in Thailand, when we talk about HIV/AIDS, it is like a general disease. But we are not harm. We are trying to monitor. We don't want that curves come back again. So today I will share with you from the situation, from the first situation in Thailand until now. Okay. I make the start where I am here in Thailand in the deep south area. So, okay. Before we start the detail, let I share with you some situation in the past first. What happened in the past? Can you see my video now?
Not yet.
Not yet. So I will share my video. Already?
Yes.
Okay. This is the part
It's the developing world that has been hardest hit by the AIDS epidemic. 90% of the people infected with HIV live in developing countries. Most don't have access to the drugs that could keep them alive. The cost is way beyond their reach. In the West, the introduction of drugs that inhibit the AIDS virus, antiretroviral drugs, has radically changed the outlook. Hospices and hospital wards have closed. HIV remains ultimately fatal, but is now a chronic disease that can be treated. Most antiretroviral drugs are still under patent to the multinational companies who make huge profits in the West from them. But for AIDS sufferers in developing countries, their cost is a death sentence.
This is the worst, probably, epidemic mankind has ever faced. If we really want to tackle it, as we have been able, or we are busy to do in the north, here in the south, we have coming treatment available.
An educational campaign has helped slow the spread of AIDS in Thailand, but they still have 1 million HIV-positive people. Thailand and South Africa are two of the countries that can't afford drugs for their HIV patients. Both are now campaigning for the right to essential drugs at affordable prices. Rahmo is 29 and has AIDS. If he'd been able to afford antiretrovirals, he would not be paralyzed and bedridden today. But Rahmo is one of the luckier ones. With the help of a project, his family is able to care for him at home, a great improvement on the treatment afforded most HIV and AIDS patients. The home care nurse and doctor visit regularly, giving support to his family and supervising the treatment of the kind of infections that attack HIV and AIDS patients.
There's a lot of things that you can do, and you can treat all these opportunistic infections, and people can live longer and have a better quality of life.
Without this help, the family couldn't cope. I don't want others to be like me. I sometimes suffer, but I don't feel hopeless. I worry about my sister and her children, that they learn to be safe. Antiretroviral drugs are not an option for poor families like Brahmos.
If we would have been able to afford antiretroviral medicines early on, it wouldn't be in the situation it is now.
In the 1977, the World Health Organization realized that the world was not getting a good deal. And they made this model essential drug list, which is basically an example for countries to actually do it themselves.
Essential drugs are defined as those that meet the health needs of the majority of the population, the drugs that are essential for life. It's vital that these be cheap, safe, and efficient. Generic versions of most drugs on the World Health Organization's essential drugs list can be produced cheaply because they're no longer under patent.
Antiretrovirals are essential drugs, although they're not on the essential drug list yet. And that's where the problem starts.
They're not included because of high costs. The only antiretroviral drug currently on the essential drugs list is AZT, and that only to prevent mother-to-child transmission of HIV.
So, if you see from the video, we can see that situation in Thailand at that time is similar to Africa. So the infection is very high rate, and we got a lot of impact problem in Thailand. From that point, we have so many campaign in Thailand. so many campaign in Thailand that happened. So before we focus on the HIV management in the pregnancy women in Thailand, let me review all of you about situation. First case report in Thailand is about 1984. And from that time, maybe around nearly more than 10 years, the rapid increase of HIV/AIDS infect infant in Thailand. And after that, the rate of the pregnant women rose from 0.2 to 2.06%. So this very, very quickly. After that, early response in Thailand about the prevention of maternal to child transmission of HIV. The national survey had been implemented. We found that 25 to 42% of the infection and is caused transmission to the children. The public health promotion campaign and 100% condom use, including radio and television broadcast, is very worthwhile at that time to raise the social awareness about the HIV/AIDS and try to decrease the infection rate in Thailand. And after that, we have some campaign about the infant formula for HIV/AIDS infection mother, decision model analysis to support bottle feeding and free infant formula for breastfeeding. Thai Red Cross starts Sidowudin donation program in Thailand. After that, we have the National Prevention Mother to Child 1997 until 99, the pilot PMCT project. HIV testing for pregnant women and Sidowudin youth starts 2000, government hospital integrate PMTCT to routine maternity care, HIV counseling, voluntary testing of ON and ART infant formula. 2003, we have PMTCT service under universal healthcare coverage. It means that support or treating the HIV/AIDS is already in the national healthcare overage policy already. 2007 to 14, we cover this service to non-Thai HIV infected pregnancy because in Thailand, we have many workers from our neighbor country. So we can control some transmission in Thai people, but if we don't work with the foreigner or the worker from non-Thai people, so it may start to increase again. So we cover this service too. And we are very lucky that we are very high support from Global Fund to hospital. So in Thailand, if you see the successful in working with HIV/AIDS, in general people and in pregnancy women, it's come from both sides, government and non-government section. That's very lucky. And we already start Sidowudin at gestational age about 34 and after newborn.
Miss Priya, I'm so sorry. The slide hasn't moved yet.
Not smooth yet, right? มันก็ค้างอะนะพอถึง
Maybe
เวลาก็
you have to stop share first.
stop share and share again, right?
Yes, thank you.
Okay. Okay. So already this one, and in 2004 we have the single dose nevirapine. 2007 we had SAART in pregnant with the postpartum based on CD4, and 2014 we had heart therapy, and we have test high risk with viral load more than 50 copy or infant of maternal take heart less than 4 weeks. They will offer Sidowudin, Lamivudin or nevirapine for 6 weeks. Both high and standard infant have PCR test at 1, 2, and 4 months after delivery. And after that, confirm HIV antibody at 18 months will be done. So from the start point, we have very crisis spread of the HIV/AIDS. And after that, we have the policy and the collaboration between government and non-government until we can have the service for Thai people, especially pregnant group, and not only Thai but non-Thai worker. We already cover the healthcare coverage to this group of people also. And during the COVID, we also have some campaign too. In case, okay.
Miss Priya, maybe we can help to share the slideshow from here.
AIDS, TB, and STDs has revealed that new cases of HIV in Thailand are declining to less than 10,000 per year due to higher use of condoms and advancements in preventive medicine. Dr. Samanpur Thargoon, Director of the Bureau of AIDS, TB, and STDs, revealed during a press conference that the rate of new HIV cases per year has dropped from its peak of 150,000 to between 6,000 and 10,000. The Ministry of Public Health plans on reducing the rate of new cases to less than 1,000 per year by 2030. Dr. Patni Piti Sutitham, head of the Vaccine Center of the Faculty of Tropical Medicine at Mahidol University, revealed that the progress of developing an AIDS vaccine in Thailand has entered its third phase. The most recent testing on HIV-positive volunteers saw an increase in immune cells. The results are promising, as HIV infection can lead to a progressive failure of the immune system. The center is conducting tests under the AD26 program, which involves administering the vaccine to male volunteers.
And so right now in Thailand, the situation is not so serious. We have worked for a long time until the beginning of the infection until right now. Situation is not so serious, but we still remain develop the standard treatment for this group of patients. If you would like to more further into detail about the standard service of HIV in pregnancy, I recommend this paper from Syed. You can search and read again into detail. I will summarize for you about the general guideline for the pregnant women in Thailand right now. All pregnant people with HIV will take HIV medicine, benefit to self and baby and partner. Second, most HIV medicine are safe to use during pregnancy, and pregnancy people with HIV use the same HIV treatment regimen. On pregnancy, people with HIV start HIV medicine as soon as possible, and as a schedule, cesarean delivery or C-section to prevent perinatal transmission of HIV is recommended for people who have high or unknown viral load near the time of delivery. This is the antiviral drug in pregnancy in Thailand that we use based on the situation or the of the patient. About the management HIV infection pregnant women in conclusion, when every pregnant women come to the antenatal clinic, first thing they will have the counseling to assess if they are risk or non-risk group, and then every of them consent to take in case of they are not ready to test, we will follow them until the third trimester, and we recheck their decision again if they would like to test or not. After that, if they need to have the drug, antiviral drug, CART, combination antiretroviral therapy will be given to the pregnant women. And after that, during the pregnancy, we will investigate opportunistic disease, especially TB, that it can be found in Thailand. And after that, during the treatment, we will monitor CD4 in advance, and every 6 months, if the CD4 is more than 350, maybe we monitor it after pregnancy about once a year. And after that, we will check the HIV viral load at 32 or 36 weeks of pregnancy. And in some case, because in pregnant women, some of them they will develop the GDM during pregnancy. So we will have the 50 gram GCT before we start the drug. And we have urine sugar test, and we check the CBC. If the hemoglobin less than 8 and hematocrit less than 24, we will not use SST. And we will check creatinine clearance if less than 60, not TDF. If you want to know TDF, we can check from this table. Factor to successful care in Thailand. I think hospital network is the keyword of the successful in Thailand, because in Thailand is it very awareness of the social sector, public section and government section have to work together. This is very important, because if we don't work with the society, they will still have some negative with the patient. So we work together hand in hand, and we use the CBO or community-based organization together with non-government organizations. So in Thailand, we have NGO around Thailand to work with this issue, because we are multicultural society, especially in the border area, southern, northern, or northeastern. We have to work hard with our neighbor. So this collaboration is very important. And from the beginning until the end, right now we have some excellent service, especially the one-stop service for the patient or the client who are infected to HIV/AIDS. And we try to work hard on prevention, decrease number of new cases, the campaign for condom use, or change the attitude of the HIV infection people not to transmit the disease is very important. And social support to improve quality of life is very important as well, because after the infection and we have many people die from HIV/AIDS, we don't leave anyone behind. We try to promote and let them be part of our society. So if we go to the district hospital, every level, we will invite the HIV people, infected people, come to work with us, like the peer group, support group, or something like this, to work at the volunteer in hospital. He or she will be something like coordinate with the new case, support new case. So we will not lose the case, because we have strong of the social support group, something like this. So that's all about the management of the HIV/AIDS in pregnant women in Thailand. From the past, we have very serious, we had very crisis situation until now. People with HIV/AIDS, they live like the general people. The bias, the negative attitude is quite very gone, nearly gone, but still remain in some area, but not so strong like in the past. So maybe you need some question we can discuss, then I will share more about this topic.
Okay, thank you so much, Miss Priya, for your insightful topic. I think we have so many insight for this topic. Maybe I will read a short summary about this topic. Seropositivity rate amongst pregnant women increased significantly in Thailand. Early response in the prevention of mother and child transmission in Thailand start from 1988. National prevention of mother and child transmission of HIV policy in Thailand involve government and non-government organization. Okay, I think we have to move to next session or discussion session. If anyone has any question or would like to discuss any points, please feel free to ask. Just raise hand or you can type in chat room. Khalid. Okay, you can unmute your microphone, Khalid.
Mohon maaf Bu, di kolom komentar Bu, ininya
Boleh
bertanya.
langsung saja, boleh langsung.
First preventive measure should be taken from baby born to while waiting
Baik
for
Bu, sebentar.
Khalid.
Baik Ibu.
preventive
Okay.
measure should be taken for baby born to mother with HIV. Oh, okay. I already present in the one slide that we have monitor. Let me show you again. Oh, let me show you some.
Okay, Professor, maybe you want to maybe I read the
We
chat
have
first.
the series when the baby born we test HIV test, and after that we follow up until 18 months. That is the answer. So when we have the test preventive measure start from we check if the mother take the antiviral drug perfectly, completely or not. And after that, we have some treatment during delivery. And after the baby born, we have some test and we follow up one month, 6 months until 18 months after birth. So to make sure that they have infect or not. And after that, we will treat them differently, something like this. Thank you.
In 8 months.
Yeah, 18 months
18
until
months.
18 months.
Okay, 18
1.5
months.
years. Yeah.
Okay, thank you. Desi.
And another question for Samaya Putri, Samaya, very difficult for me is we promote the bottom feeding to make sure the window feeding period when the baby born with the mother had the HIV infection, we don't allow them to breastfeed and we have bottom feeding to make until he will not infect, something like this. So there may be one method to prevent. We don't promote breastfeeding in this group of patients.
Okay, no breastfeeding allowed. Okay, thank you so much. Desi, is it clear?
Let me introduce. I am Muhammad from Nursing Study Program. Permission to ask what is the impact of unequal access to HIV treatment in low and middle income country compared to high income country?
Maybe these questions are addressed to Professor Gilani. Professor, are you still with us? Professor Gilani, are you still with us? I think due to the signal problem, Professor is not here with us.
May I share some? something in Thailand about this situation.
Okay.
Even Thailand, we are not the developed country, but we still have the high education or high income group and low income group in Thailand. So how to promote the access to healthcare service in this case? What happened in Thailand is the good high education is no problem. They can access to the private hospital, no problem for them. But for the low income people, we have some non-government organization to work with the low income area, the worker or the in slum, in the poor village or something like this. So we have the non-government section, we have the volunteer group to work with it because we are aware that there are many HIV people. If the government section lost this group and leave alone, it will come back with the problem again. So we work hand in hand with the non-government section. Non-government section they can go to the low income area and work with them and invite them come to the service, something like it. We have Stella Maris Seafarer, that is the NGO group that work in the group of the fishing area, fishermen, fishing workers, something like it. They are supported by the non-government section and work with this group of people. So as I mentioned before that how to treat is if they are different background. So if we are aware that people are very important and you are treated equal, we have to think many strategy to access this group of people. We have to think they are there. Don't think that Thailand is a rich country because we have enough money, but we have to think about the low income, the worker, in the border area or something like it, or two nation people. Sometimes between Myanmar, Thai, sometimes Malaysia, Thai, something like this, them cross country. So we have to think about this group of people and then we have to find strategy to access. And in this thing, the government, the non-government work very hard and it's very successful. So if you are in Indonesia, not only in the hospital, but you have to think about the social support or the network or the religious group or something like that to work with this group of people and to be like the bridge between government and this group of people. Thank you.
Okay, so there are no different treatment program between the poor and the rich, right? Yeah. Okay, thank you so much, Miss Priya. Khalid, is it clear? Because Professor Gilani is not here with us, so Miss Priya answer your questions. Is it clear, Khalid?
Khalid, happy.
Okay, it's clear.
Yes, thank you, Prof.
Okay. Next question. Hello, my name is Ayu Aulia. I'm nursing student. In this session, I want to ask Professor Priya, and the question is, what role does multidisciplinary care play managing HIV in pregnant women?
Okay, I will answer based on the situation in Thailand, okay? So from the beginning, when the pregnant women or the non-pregnant come to the service, before we test, we have the counselor. Counselor will be the first step to screen. And after the counselor and after we test and we need, before we show them the result, we also have counseling again. So the first thing, I think the counselor. After
Miss Priya, I'm sorry, is counselor a healthcare worker?
Counselor is the counselor in the hospital, professional healthcare counselor. So they will be the first step. After that, another multidisciplinary, I think we have to pass nurse, doctor, social worker, social welfare, and based on the context of the patient, based on the situation. But in hospital, we will have counselor, we have nurse, we have the doctor. When they go back to community, we think about the community leader, religious leader in Thailand, especially in the Muslim population. We need religious leader because they follow religious leader in community. We have to invite them to support and work together. And in Thailand, we have the hospital, district hospital, and the village hospital, district and sub-district hospital. So we work in the community. So we need the community leader, religious leader in community. And we have voluntary healthcare worker in the village also. So many people work together, and we have to transfer from hospital to community, something like it.
Okay. Ayu, is it clear? The answer is clear? Mungkin sama dengan kita ya, di Indonesia we have puskesmas. Puskesmas is like community service. We have puskesmas for community services. Yeah. Ayu, is it clear? Any other?
Jam 2. Kami kene.
Okay. Any other questions? You can raise your hand or type in chat room. Any other questions?
If you visit Thailand when we have the something like disease or health crisis, not only HIV, in the situation of COVID, we have something like every level had very high awareness. Religious leader, Muslim religious leader, the monk. So we have the shelter that organized in the temple for the Buddhist people who lost family. It is in the central Thailand. If everybody die, nobody support you, you can go to that temple to support. And then that temple will link back to the hospital to something like this. In Thailand, that is very common. I think in Indonesia also.
Yeah, the same. Okay. Any other questions? No more questions? I think it's enough. Miss Priya, maybe there are something to say?
I think I love Indonesian students. They have many questions. I think I love that kind of situation or atmosphere like it. And thank you very much to invite me to join this session. As my background, I used to be the evaluator of many HIV/AIDS projects in the past. So this show that we work very hard and successful healthcare service come from not only from the mainstream like the government section, but we need network, we need collaboration from many of people, many of sections. So to think about this, we have to, you may get some idea when you finish you finish your graduation, you face some situation of the health situation. Don't think only yourself as a nurse, as a teacher, as a lecturer, or something like this. This world is for every people. Every people, they are willing to support each other, something like this. So think about network. Network is the key important for our success in our job, in everything, in every situation. Thank you for inviting me today.
Okay, thank you very much, Miss Priya, for your insightful topic. Yeah, I think we have so many new insight from your presentation today. Okay, thank you for your active participation and attention throughout the seminar. I hope what we've discussed bring benefit for us. Thank you again, Miss Priya and Professor Gilani, and have a wonderful day. Thank you.
Thank you. Bye bye. สวัสดีค่ะ
สวัสดีครับ
Alright, thank you very much, Dr.Preeya, and thank you very much, our moderator today. Our knowledgeable speakers is so great. We have interactive discussion. Thank you very much, our moderator. We appreciate your insight. That was truly enlightening. Alright, ladies and gentlemen, next we will present certificates to our speakers and our moderators. I would like to call upon Mrs. Poppy Sitaisha, the Dean of the Faculty of Health Science, UNISA Bandung, to present certificates.
Okay, thank you, Miss Mariana. Assalamualaikum warahmatullahi wabarakatuh. I will give a certificate for Dr.Preeya, Assistant Professor Dr.Preeya. Thank you very much. Very interesting in your topic for this afternoon in Indonesia. Thank you very much for loving my student. Maybe we can always join with UNISA Bandung and Prince University Prince of Songkhla.
Thank you very much, Mrs. Poppy, to present certificates. Thank you very much, Dr. Preeya. We hope to see you at our next event. Alright, because Dr. Syed Amir Gilani is not joined again in the Zoom, we will send the certificate to Dr. Syed Amir Gilani. Thank you very much, Mrs. Poppy. Alright, ladies and gentlemen, how was this discussion? Are you tired or are you feel sleepy? I hope we re-energize, right? Because after that, we will announce about the door prize winner. So don't go away. Please stay with me because we will announce the door prize winner. But before that, we will display a posters for you. Now you can relax and enjoy the poster. gentlemen, before we conclude, we have an exciting moment. The announcement of the winners in today's webinar. We have 3 winners from the quiz and we have 1 winners for best participants. Alright, let me announce the winner. For the first winner from the quiz is Lailatu. Congratulations for the Lailatu. Second winner is Gita. And third winner is Anissa. Congratulations for all of you guys. And for the best participants, we have Zikra. Congratulations, Zikra, for the best participants. For all winners, you can contact the committee for the prize. Alright, ladies and gentlemen, allow me to remind you that don't forget to fill the link attendance. The link has been shared in the chat column in the Zoom. Izinkan saya untuk mengingatkan untuk seluruh para peserta untuk mengisi link kehadiran. Link kehadiran sudah dikirim melalui chat column di Zoom ini. Alright, ladies and gentlemen, we've come to the end of our event. Many thanks to all of you guys, to our outstanding speakers, and for all participants for your active involvement. Alright, ladies and gentlemen, I would like to extend a heartfelt thank you for everyone to play a part in making this event successful. And don't forget, allow me to remind you that tomorrow agenda is oral presentation. Agenda besok adalah oral presentasi. So, give the best of you. Alright, ladies and gentlemen, your contribution and your enthusiasm greatly appreciated for me. We hope to see you at our next event. On behalf of the committee, I would like to express our apologies if there are mistaken. With that, I bid you farewell. Thank you very much for today's international webinar, Adapting Technology, Implementation of the Solution for Management of Human Immunodeficiency Virus. Thank you very much. Have a great day. I bid you farewell. Wassalamualaikum warahmatullahi wabarakatuh.